in Rajasthan and again became Vice Chancellor of Madurai Kamaraj University. Now the Vice Chancellor of very great institution, Central University of Tamil Nadu, Tiruvallur. Sir, we are extremely proud to have you in our midst, sir. Welcome you, welcome to this function. We are so fortunate to have him to inaugurate this function. Thank you, every one of you, for attending this particular function. Thank you very much for this opportunity. Thank you.
Respected and beloved advisor, respected medical superintendent, vice principal, heads of the various departments of Sree Balaji Medical College, chief guest for the day, Honorable Vice Chancellor from Central University, Tiruvallur, invited guests joining from the other parts of the country, delegates and friends. It gives me great pleasure to deliver the presidential address today, as we have gathered to have the first of its kind, the national conference conducted by Department of Sports Medicine and Yoga by the hard work of Professor Murthy. I congratulate the organizing team for coming up with a spectacular performance, and we should appreciate the efforts put in to get it approved by the Ministry of Sports and Youth Affairs. And this program is partly sponsored by the Ministry of Sports. Sports medicine is a developing field, and it is an umbrella subject which not only has the medical professionals but takes along the paramedical specialists also. And it is not restricted to just the sports persons. And today, everyone is fitness freak, and everyone has got a app in the mobile, and they are concerned about maintaining the physical fitness. In that way, not only the sportsmen, but also the lay people who are at home and who do regular exercise are amenable for injuries. The musculoskeletal system gets into trouble if we do it in a wrong way without a proper trainer, or if we overdo things out of enthusiasm. Now, in that situation, the sports medicine comes into play and helps the injured sportsmen as well as the others to get back to the normalcy and start their career all over again. We all would have seen in the media now and then the popular sports figures getting into trouble because of injuries, and every sports has got its own unique parts of the body which is put into trouble. For example, the cricketers, they strain their shoulders, especially the bowlers, and like that, every sports has got its own trouble, and it is very important they have proper trainers. And as I was talking with one of the eminent emeritus professor of orthopedics this morning, he was just mentioning he was a sportsman, great sportsman in his times. He was in the national team and he was in doing his MBBS, and he was mentioning that of late sportsmen from the rural parts of the country are also encouraged to enter the scene and perform in the national level. In that way, this sports medicine has to be carried to the tier 2 cities and the towns, and it is high time all the medical students are taught a little bit of sports medicine and rehab medicine in the MBBS curriculum. The latest revision in the curriculum has some kind of introduction to the physical medicine, rehabilitation medicine, So I request all the faculty members here to orient the graduate students to the developing field of sports medicine. And I once again congratulate the organizing team for coming up with this event. Thank you very much.
Indeed, a privilege to have with us Honorable Vice Chancellor of Central University of Tiruvallur, Professor N. A person with astounding accomplishment with love for life sciences. Yes, our professor has taught life sciences, particularly environmental science and biochemistry at various prestigious institutions across the country. Administration is his second nature. He was the Dean Academics at Central University of Rajasthan, where he was also the coordinator of yoga. Sir was the Vice Chancellor of Madurai Kamraj University before taking charge at Tiruvallur. His best research is evident from the various positions he has held and from 23 research scholars he has guided till date. The results of research has given him more than 150 publications. He has also authored several chapters and books. Dear colleagues and friends, let's put our hands together and welcome Professor Pravini Pradayam for inaugural address.
My dear and respected Professor Ramasamy, my teacher, my well-wisher, Professor Dr. Johnson, who had given the presidential address today, and Professor Murthy, who is responsible or who is the person to invite me to be here to inaugurate this wonderful conference. I have that eminent doctors here going to give the felicitation and related things in this wonderful conference. I'm so happy to be here to inaugurate this seminar on sports science and yoga therapy. Before I am coming to this particular topic, I want to tell that the higher education, Professor Ramasamy will accept it. The higher education is very much important. It's not only getting that degree or not only getting that a higher post or not only getting the salary, living very happily. The higher education is very important to take that excellence in higher education. From the excellence, innovation should come. That innovation should go to the society. So you all doctors know that, how you are related to the society. But we from the higher education side, we are looking for how we can integral part of that society where we have to give the innovation from the higher education. I think you know that even though we have the thousands of universities in India and for 50,000 colleges in India, 200 research institutions in India, but none of them we are not reaching the global ranking. Why? Because we are not taking our product, we are not taking our output of higher education to the society. So now everybody is looking at how we can do something for the society. So today this wonderful conference is going to tell that how that sports medicine is very important for that regular life. Some of the students, they misconception that sports science means, sports medicine means only for that the people in the sports area. No, it's not like that. This is the area everybody should participate. So Mahatma Gandhi rightly told that, because we are in that Republic Day celebrations. When he 1937 he told or he submitted that how the higher education should be. He told that along with the degree, every student should have that skill in a particular area. So that's the way. Now we are looking for different skill. My friend, when he's giving the presidential address, he rightly told that where we have to start. That is a very important questions we are all put together. We have to that professors, the eminent professors in the different departments should give little change by giving that curriculum with the sports science. So every student should know that. So that's the way today, my dear and respected professor started this wonderful conference going to tell about, to bring the experts from different area, how the sports science is important to each and every people. When you are going to that, what you call the Google or something, it's that area is developed in the 1990, but it's promised in the 2020. When I was in Central University of Rajasthan, we presented the proposal to Government of India for about 25 crores. The first sports science department started in 3 universities in India. Number 1, Patiala. Number 2, Annamala University. Number 3, Central University of Rajasthan, where we started 4 departments under the sports science. Number 1, sports psychology, sports physiology, sports medicine, and sports biochemistry. Why we have started like that? It's full-fledged department. The government had given the permission to start with the 10 students per course. I think this having that wonderful opportunity to the students. Once they completed the course, they got that very good employment throughout the country, not only the country, throughout the world. That's the way we started. But now it's having that more attraction towards the students. Particularly the doctors should come forward to learn that how the sports science, sports medicine is very important. How you can apply that yoga therapy for some of that very, small things happen. Sir rightly told it. Today the lifestyle is different. Where you have to do that? I think if you are coming to my house, my brother said, we're always sitting in the computer. In the 30 years or 40 years, they are affected by central nervous system. They have the problem in the eyesight. They are not taking the food properly. But so on and so forth. Immediately they are going to the doctor. I'm sorry, don't mistake me, but immediately they are going to the doctor, taking some medicines, and they are coming out from this one. They don't know the practice what we are having in our earlier life. This not told by me. Our Honorable Prime Minister one day, Fit in India program, he told the 3 important things. I also wondered to see the statement. I don't know how many of my students are now know that. First thing, he is taking 3 examples only from Tamil Nadu in the Fit in India program. Number 1, I don't know how many of you, my seniors, know that Koli Kundu Vilayadal. What is that? When I'm seeing that, I feel wonder that what is that? What do you mean Koli Kundu Vilayadal and you are going to Fit in India program? He's telling that when you are going to play with that Koli Kundu by using the fingers, where the fingers are going to get the strength. When your fingers are going to get the strength, your handwritings are very good. When your handwritings are very good and frequently you are using your fingers for handwriting, your unutilized brain area is going to be utilized, scientifically proved. But now, we are not allowing our children to go for this type of things. The second thing he told, Even so many people, they don't know that now its culture is coming out. Pannanguli விளையாடுதல். That is the second sports he is telling, where they are using that fingers again. And also along with the sports, they are learning the mathematics. See that, where it has gone now. That's a routine life. I don't know how many doctors you will accept it. Second thing, Nundi adithu vilayadudal. He is telling that. What it's going to say that particular the girls when they are doing it, he told that the menstrual cycle is regulated by doing this one. But these are all that part of the yoga. So that's only we are telling that every village, every, city is having its own culture. We have to follow. When we are talking about the sports medicine, don't take it very seriously. Whatever you already had it, you bring back. That is what you call the sports medicine. For example, your Bharatanatyam is your yoga. Now we are regularize the things. In the sports side, we are going to regularize the thing. So I don't want to tell all the stories what we are having today. Because we have all the technology. My dear young students, India has all the technology, but we left out. That's a problem today. Not only the sports, but not only the yoga, not only that our own exercises. Even I'm seeing the difficulties. Even my children, when I am seeing that without the Western toilet, they can't live in the house now. They can't sit and eat in the floor when we were the children. But that is also yoga. When you are going to sit in the floor and eat your food, you are going to regularize your diet. Yeah, limited diet only you can take. Doctor will accept it. You should not fill your stomach with 100%. We have to give that what you call vacant 25%. What you can get it when you are going to sit in the floor and eating something. So like that, so many stories I can say that. We lost everything by following that Western culture. But now, Western people, they are going for the sports medicine and yoga therapy. When I was in Germany, I know little about the yoga. My professor told that you can train our students giving that yoga, just 4 or 5 things. Asanas you can tell. They want to pay. The students are coming and want to learn that. They are now very keen on going to the sports medicine. And they are applying that yoga therapy. One disease I can say, you have everything in your body. You can, if you are properly follow that, you can control your diseases. One thing I can say where I did my research, prostate cancer. Why it happened? So the two hormones, androgen and estrogen, doctors very well know that. Unnecessarily, it's going to express in unwanted time. It's not for everybody, right? So our system, I don't need to tell here because Professor Ramasamy is here to tell everything. Even though we have 30,000 genes, 1 lakh of proteins in your body, it's having its own way to control everything. But we are not doing properly. That's the thing. The sports medicine is going to tell about it. So the sports medicine is going to tell us that first you learn the system, your body system. Apply little yoga. No need to practice heavily. Apply little yoga and without the medicines you can control. If it's going above than that, you have to go for that a very good doctor. Yeah, we are accepting it. But I can say that that's a problem is, I mean, don't mistake me. I am telling the example of my own wife is a medical doctor. So when they are getting the headache, yeah, it's because of the tension, overwork, or whatever it may be. Immediately they are thought that, oh, we are having some brain tumor or something like that. Then they are relating so many things. But simply you can do that medications where you can come out from your tension. It's possible. Every day, I am very happy. I don't have sugar, I don't have pressure because I am running 66, my age. But what I am doing that simple walking for half an hour, meditation for 10 or 20 minutes, then just yoga for 2 or 3 asanas. Because when Professor Subramaniam, who is the vice chancellor of that yoga university in Bangalore, when I was heading the department of yoga, he told the Professor Krishnan, don't try to do all the yoga what the people are doing. Don't do that. Because unnecessarily don't give the strains to the body. So slowly you can learn 5 or 6 where you can control everything. So like that, according to your age and the ability, you should do the yoga. Don't, my friend told that in the presidential address, don't give unnecessarily pressure to you. It's not good for you. That's the way now we have to do that. As a vice chancellor, what is my request is, I mean 40, 50 doctors are coming in a year in a classroom. How you are going to differentiate the doctors? All are having MBBS degree. So they should have their own skill in particular area. That's the thing, our presidential address had given that. Change the curriculum such a way to bring back that our old traditions like sports medicine, yoga into our syllabus. Because you have every right to change the syllabus 10 to 20%. And then you can include the new subject. Because now new education policy is telling that multidisciplinary research, everybody should come together. And then we have to work for that. And another very important thing, my dear doctors, kindly learn something from my villagers. One example I can say, we have a lot of technology, but we forgot about it. I don't know how many of you know that there is a place called Tindikal. There is a district where we have the very good technology for the lock making. Tindikal Puttu is very famous. But where the technology has gone, why we left out? And we have that every house now we are having the naphtha. Where is the technology has gone? Like that, Madurai, if you are taking, the jasmine of Madurai is having its own smell. Tradition. Why? The scientific research is not available. Like that I can say Tirunelveli Halwa, Manappare Murukku. But why? Where is the technology? Why our students, our children forget about it? Like that, we forget about the basic idea about our body, behavior. Everything you forget about it. I am from a small village near Madurai. Yes, I am from the agriculture family. But my own child who is learning that BDS here, nearby university, is asking that whether the paddy is coming from seed or what you call a plant. He doesn't know that. He doesn't know that what is agriculture today. So my request is, you can study whatever you want there. But at the same time, don't forget our culture and history of what you call the villages. I don't know. How many of you know that? Because I have to tell that. I'm sorry, I'm not taking much time. I will complete it in 2-3 minutes. How many of you know that Vedaranya? How many of you people visited Vedaranya? Please recall. Yes. when you are visiting Vedaranyam, when our Mahatma Gandhi started that our Tandi Yatrai, from Samarbadi to what you call Tandi, the same time, the Uppu Satyagraham started from Tiruchirappalli to Vedaranyam. Right? But when I reaching here as a Vice Chancellor, I don't know that. I don't know that what's happening in Vedaranyam. I visited on 25th of January, where I could see the jail where our Rajaji is put over there. Because of that, when Mahatma Gandhi did it there in Tandi, he did it in Vedaranyam. When I went there, I'm sorry, please visit the place. Our culture we have to learn. Where it started, Vedaranyam, why he selected? Anybody knows that? Why he started from Tiruchirappalli to Vedaranyam? The message is, I have to tell, I am telling to every colleges today, a father is people who is saving that. ஒரு சவர தொழிலாளி, he started that education with that English people. What he told that, whoever getting the salary from the British government, I will not save the people. அவர்களுக்கு நான் முகச்சவரம் செய்ய மாட்டேன். Where he told it in front of the court. He put it in the side, jail and hang. Go and see that Vedaranyam. Along with the Vedaratnam Pillai, he is there. He is a, example, living example. You can see that. How he started. So like that, why I am telling this one in the sports medicine, like this history, we forget about that sports medicine. We have, you see that. My father didn't have anything, pressure or something, anything. My mother didn't have that. Morning 5 o'clock, we woke up and went to that agriculture work, and he did it along with all the sons. What we were in the 5 members. We are doing that agriculture work. We feel proud to say that we are healthy. But we are not giving the same tradition to my children. No. Even my daughter, my brother's sons or whatever, they are sitting and they are doing that in front of the computer. I'm sorry to say that, IT. From morning, 9 o'clock to evening 6 o'clock. And mid of the night, they are telling that we are in the meeting. So they spoiled everything. The similar way, next generation also coming. So, my request with the dean, principal, vice principal of this wonderful college, you started exactly right time with the help of Professor Murthy. Because Professor Murthy is an important person to bring that sports science to Rajasthan and also Patiala and also the Annamala University. 25 crores of money, it's not easy money from Government of India, Youth Affairs Ministry. He was in the committee, he told that, yes, this university should have the ability. So like that, I wish that this university should get that sports medicine department and they have to bring lot of money to that. Even some of the research papers, pub media. Today morning, I see that 5,000 papers published yoga therapy and sports medicine with the referred journals. You can see that. So they are giving throughout the world, they are giving that importance. How the sports medicine is very important. Today, I want to complete with that. What we feel that today, the humans are the superior nature of that, the world. But today, a small virus teaching us how you have to live in the life universe. You have to take care of the environment. You have to give that what you call all the attention to the environment. That's the way life is going. So my request is, Before I am completing this inaugural address, I want to tell that please take care of the environment, respect the elders, live with the elders, and also get with that wherever the people, doctors, you are that. My brother always saying that after the God, we are giving the life, the all belief to the doctors. So you are equal to that God. So kindly take care of my society. Don't forget about our village. Bring back all that good things from the village, and we have to follow that our life. With this, thank you very much for giving the wonderful opportunity. Thank you.
Thank you so much for your kind words of encouragement. I wish we go back and bring the forgotten practices so that you could have a fitter and healthier tomorrow. Thank you, sir. May I now request our Dean, Dr. W. Johnson, sir, to honor our chief guest, Professor Dr. M. Krishnan, sir. May I now request our chief guest to please make the book release. I request the other dignitaries on the stage to please join. Thank you. Thank you, sir. To add to the glory of this wonderful inauguration, we have with us the Vice Chancellor of Guru Nanak Dev University, Punjab, Professor Dr. Jaspal Singh Sandhu. It's indeed a privilege to have the person instrumental in establishing the first department of sports medicine in our Indian university system amongst us. He has been awarded fellowship by various prestigious institutions. He was the former secretary of University Grants Commission. His contributions in the field of sports medicine is tremendous. Guru Nanak Dev University has excelled in the areas of academics, research, sports, and cultural activities under the gifted, proficient leadership of Vice Chancellor Dr. Jaspal Singh Sandhu. Sir, may I now invite you to deliver the keynote address online? Sir, are you here online with us, sir? Sir will be joining us in a while. May we now have another guest of honor of today, the Director of the Central Council for Research in Yoga and Naturopathy, New Delhi, Dr. M. Raghavendra Rao, sir. Sir did his doctorate in Yoga and Life Sciences. He worked at Vivekananda Yoga Anusandhana Samastana University. Later, he pursued his research interest at Healthcare Global Enterprises. He has done several research.
नहीं पता आपको टॉपिक क्या है आज?
He has done several research in rheumatoid arthritis, pre-diabetes, diabetes, coronary vascular disease, risk prevention with yoga and naturopathy interventions. He has won several laurels in research. The American Society of Clinical Oncology conferred on him the Conquer Cancer Foundation Merit Award. May I now invite Sir to deliver the special address online. Professor Dr. Raghavendra Rao, sir.
Well, thank you, madam. Am I audible?
Yes, sir. Yes, sir. You are audible, sir.
Namaste to all of you, and apologies for not being present there in Chennai today. There was such a certain emergency was there because the budget session is starting, and we are all supposed to not go out of the station. That was the reason, and I couldn't be among all of you. But nevertheless, I'm happy to be online to share my thoughts and my wishes to all of you. It is commendable to see Balaji Medical College hosting this conference, a unique conference on sports medicine and yoga. This is the need of the hour because a lot of work has been happening in this area in the Western countries, but not much is happening in India. So as you're all aware, and as my speakers have already told about this in the earlier speech, especially Professor Ramaswamiji and Professor Krishnanji, who did a very elaborate talk about how yoga could be very, very useful and important in sports. So the two important aspects which I want to share here. Yoga can be used in two different ways in sports medicine, not just as a part of our lifestyle. So yoga can be used to improve one's performance. Okay, one is to improve one's human performance in sports. The second one is to also help in sports rehabilitation, to prevent sports medicine injuries and help in rehabilitating people who have injuries because of the stress and strain of participating in a sport activity over a long period of time. So any sort of sport which is physical, all these things can endure a lot of physical stress on your body, on your musculoskeletal system. And to protect the musculoskeletal system, it is also very important to have adequate amount of rest and adequate amount of environment to reduce the inflammatory activity. So before coming into rehabilitation, I just want to give you a few words about human performance. It was almost around 2 decades back. I had met one sports medicine expert, a very, very famous one in US, called Dr. John Back. So we had organized the first Asian conference on Duchenne muscular dystrophy at Bangalore here. And all these top doctors, rehabilitation specialists in sports medicine as well as in clinical medicine were here in Bangalore, where they had talked about various aspects which can be used in yoga or rehabilitation for Duchenne muscular dystrophy children. So one thing which caught my attention was of Professor John Back. He was a coach, also an advisor to Michael Phelps. So all of you know about Michael Phelps. He is a 18-time Olympic gold medalist from US, a swimming champion, and nobody has conquered this particular fort in the swimming arena like him than ever before. So Michael Phelps was few milliseconds ahead of his competitors, and that is what was winning him gold. You know what Dr. John Back was telling was the reason why he was winning gold was because he was able to stay underwater for a longer time. He did not have to come out of the water to gain the breath or take the breath, because coming out of the water means lot of drag. It will slow down his speed. So he was able to stay underwater for a long time. And how did he do this? He practiced one particular breathing exercise in yoga called Pravini Pradayam. It's also called as Glossopharyngeal Breathing. What they do is swallow mouthfuls of air, increase the lung capacity, increase the lung tidal volume, increase the lung reserves. So you don't have to breathe more when you are jumping and taking the dive into the swimming pool. So this was one very, very important, interesting thing which came out to see that how yoga was used in a different way. Though they were using the word glossopharyngeal breathing, this has already been mentioned in our yoga text that you can do Pravini Pradayam and you can stay underwater for longer hours. Okay, you can float on the water, and this makes all the swimmers very, very agile. Okay, and increases the speed, increases their endurance, and increases their performance. This is one such example. So yoga can be used in various and diverse ways to improve the performance of the participants. For example, if you are a rifle shooter, if you're going into shooting practice, so Trataka is a very, very important exercise which can really help in improving the focus, mental focus, the attention span. You practice the shooting when you go into a shooting arena or going to a shooting competition. Similarly, the same thing with respect to archery as well. Okay, and these things have been taught over a lot of centuries ago. Okay, you must have heard about Arjuna, you must have heard about Eklavya, the story of Eklavya and other stalwarts who've been taught by the Guru Shishya Parampara tradition, where every day morning they were supposed to do yoga. Okay, and all these sports has been inbuilt in our traditions through generations and through centuries. And this is because, and it's been already honed by the skill of yoga. But it's only now that we have lost the touch of yoga, and now we are realizing that when the West is using yoga for various fields, okay, they're using it in basketball, they're using it in shuttle badminton, they're using it in hockey, they're using it in football. Okay, I was stunned, especially I was in US for about 2 years in San Francisco, and what was interesting to see was one of my friends who was a Shivananda Yoga Ashram yoga instructor, was coaching the football team of California. Okay, and he was teaching them all yoga, and a lot of interest is already developed in this arena. A lot of stalwarts, okay, some of the great people, even Steffi Graf was taking yoga. Andre Agassi also takes yoga. A lot of people have taken recourse to yoga to improve their performance at some point of time. So yoga can be really useful in improving performance in various sports. All we need to do is to do a lot of research and try to see how we can apply different aspects of yoga, the philosophical context of yoga, and the benefits of yoga to improve performance in different arenas. That is one aspect. Second thing is coming into rehabilitation. Any sort of sports will also lead to a lot of injuries. And the reason for such injuries is also because when your sympathetic system is quite high, when the stress is quite high, okay, the body's ability to accommodate to that particular stressful situation is also lost. Same thing happens to you, not just to your arteries, where your blood pressure goes up with respect to stress. It happens even in the muscles as well. They become very, very taut. They don't become flexible. The reflexes are loosened, are not so agile anymore. So all these things can lead to injuries when you do this kind of sport activities. So to prevent those things, do regular yoga in your routine so that your reflexes are honed up, the muscles which are taut are relaxed, and they are comfortable, and they're able to fire when it's required. Okay, and they also go back to relaxation immediately. So when that kind of environment is there, when the sympathetic arousal comes down, when there's more relaxation response with increased parasympathetic activity, you can see the performance also improving. It also prevents injuries when you take part in such kind of sport activities. So what is required today is medical colleges like Balaji Medical College, all the faculty, the directors, the dean, Dr. Murthy, and others who are already there on the dais. I'm very happy that all of you have come forward to take this yoga into sports medicine. And there is a need for the yoga fraternity to meet the medical specialty also here, because the crosstalk can happen. You can use the right kind of yoga interventions for different kind of sports. Start developing yoga modules for different kind of sports. Test those modules. Apply those modules in the sports arena. Look at the improvement in outcomes. Okay, and that is how you should start going ahead. So I also remember where I was also fortunate to teach under Sports Authority of India way back in 1998. That was when the Sultan Azlan Shah Memorial Club was there. The Indian hockey team won this particular cup, and Sports Sai was very close to my house, and I had volunteered myself. Was also coaching the team there for about a month or so, and Dr. Ganesh, who was the head of the SAI in Bangalore, was helping in this, was very much for this kind of activities, and we saw very, very good performance and outcome in this kind of population. Same thing with the badminton team also, which was practicing there. Rishikesh Kanitkar and other people were there during that time. It's quite 2 decades old. Okay, and during that time we were using yoga intervention along with the badminton team as well, and they felt better improvement. They were able to reach the shuttle at a faster pace compared to this. But we don't have data to do this. So we require to have data analysis machines. We need to have a very good sports physiology lab to see how yoga can really benefit sports persons, okay, and people who are undergoing training. So if this is done, we can really add science behind yoga to sports, and this will really take India to great heights. With this few words, I congratulate the entire team in Balaji Medical College and the distinguished guests on the dais for giving their encouraging words to the audience there. And I hope this is a beginning for taking good initiatives in integrating yoga into sports medicine. Namaskar. Thank you.
Thank you, sir, for your kind words. Sorry for the delay. There's some technical glitch which is happening. Just few minutes. So now I take this opportunity to honor Dr. Murthy, the President of Tamil Nadu Yoga Sana Sports Association, and Dr. Chandrasekharan sir, Chairman of Tamil Nadu Yoga Sana Sports Association. So may I now please request Mr. K. Ratna Sabapati, Secretary, Mrs. Shanti Gopinath, the Vice President, and Mr. Vijay Bhaskar and Prakash, the Joint Secretary, to join the dais and honor them.
அவங்க பேர் என்ன? அவங்க பேர் என்ன? பர்சன் பேர் என்ன?
Guru Nanak Dev University GNDU வருதான் பாருங்க. GNDU வருது. GNN போடுங்க சார். நானக் DU DU GNDU சார். GNDU DU BC GNDU BC போடுங்க சார். BC போடுங்க. BC போடுங்க. BC GNDU போடுங்க. GNDU போடுங்க.
ஒரு வேலை இப்படி இருக்கிறது வாய்ப்பு.
அந்த மெயில் இருக்கு. யாராவது வெயிட்டிங்ல Thank you. Sir, Professor Dr. Veerabahu to please felicitate the gathering here. Please, sir.
Respected Dean of our college, Professor Johnson, our Professor Dr. M.
கையில வச்சுக்கப்பா
Vice Chancellor of the
ஜில்லுன்ற அதான் அது என்னன்னா
திருவாரூர்,
சரியாயிடுச்சு பாத்தீங்களா இன்னும்
Sir, you are muted, sir. Please unmute.
and talks almost every day is my habit. And today I heard something phenomenal presentation of the yoga and source from Dr. Krishnan. You should not think that I am comparing with him, a great personality from Kumbakonam. He is working in Thiruvarur. In Kumbakonam, I understand what I heard from orally from my forefathers. Where I am coming from my Lord Gurai, very near to Kumbakonam, people, forefathers, my grandfather is educated person. He is telling me about the silver tongue Dr. Srinivasa Sastri. And I remember the way in which was telling how the Sastri is giving his point in a voice of melody, music, and forceful. All those things I think I'm getting a remnant of it from Professor. Thank you very much for the real idea about the yoga and all those sports medicine. Now, thanks to the international sports today, every other day we understand that somehow some people, whether cricket or athletes or any other thing, they fall down, they get fractured, being attended only the specialists. And because when a sportsman gets hurt, there are 3 or 4 people are seeing, as I see, understand from the other people. A doctor, a physician, an orthopedic surgeon, physiotherapist, psychologist, psychiatry. I think my friend, Dr. Sundaresh knows about it because he is a state volleyball player on his days. You know what is the problem of fall. And the right time that our medical college coming from the inaugurating the sports medicine also probably within a year or 2 in the guidance of Professor Ramamurthy, Professor Murthy. And regarding yoga, and the yoga science is being taught for so many thousands of years ago, but it's being organized, coming the work only last few years. And I'm just imagining how that yoga is there. If we, just an example, if you think about our God and goddesses, they all in yoga only. For example, great Paramashiva, he was sitting for a long time as yoga posture. Ayyappan, he is sitting in the yoga posture. Destiny, she's standing in a lotus with the water. How is it possible? How is it possible? She is doing yoga also. And Lord Krishna, Mahavishnu, is lying in the Samudra. And also his bed is full of the 5 or 700 great snake. Probably like our modern bed, it is also moving. So I think Lord Krishna will not give any bed sore at all. And so also Paramatma is sitting over the tiger skin. Probably you will not get any bed sore at all. It's just a thought. So we know about yoga, it's being practiced, but as Professor Krishnan said, it has been forgotten, it's coming again. And I'm very glad all the people are other people on the base, and also Professor Raghavendra Rao and other people are going to give an idea about yoga and sports. With a few words, I wish they are coming to the we are the dawn. We see the light. We see the light. Light will come slowly and sun will come. Thank you very much.
Thank you, sir, for your kind words. May I request the medical superintendent, Dr. P. Sasikumar, sir, to please facilitate the gathering.
Good morning, everyone. Respected Dean, respected Advisor, Vice Principal, Vice Chancellor, Professor Krishnan, Professor Chandrasekhar, and Professor Jaspal Singh Sandhu, and Dr. Raghavendra Rao will be joining us online. My dear faculty, students, it gives me a great pleasure to be part of the inaugural ceremony of the first National Conference on Sports Medicine and Yoga. Sports medicine, as we know, is a branch of medicine which deals with fitness, prevention, and treatment of sports injuries. So it's a evolving field. Usually, it was medicine before. With the invent of the technology and IT, the understanding of the biomechanics of the muscle movement, the ergonomic use of the muscle and action in improving one's physical ability to perform sports in a better way and to prevent injuries. With these understanding and giving remedial measures to sports persons, that's the idea behind sports medicine, so that the injuries are less and their performance is increased. And the yoga is part of our culture. It's there since Vedic period, where yoga is described in various Vedic scriptures also. But somehow we are losing a touch in between. But with our Prime Minister's initiation of introducing International Yoga Day on June 21st, 2015, from there on, that year on, 2015 onwards, International Yoga Day is celebrated all over the world. Probably the world is coming to know about the yoga and the benefits of yoga, which gives both mental and physical fitness for the people, not only sports person, but people at large, both professionals and skilled workers also. I congratulate Professor Murthy and his team for organizing this conference. I wish him all success. Thank you very much.
Thank you, sir. May I now request the Vice Principal, Dr. Kanta ma'am, to facilitate the gathering.
Respected dignitaries on the dais, off the dais, and people who are watching online, a very good morning to all, and my respects to all of you. As all of us know, sports medicine is a branch of medicine that deals with physical fitness and treatment and prevention of injuries related to sports and exercise. And sports medicine is not only for professional athletes, it's for everyone. I will continue. And the goal is to engage, exercise safely and effectively. And
Madam, you are muted. Please unmute.
this shows what? Definitely, there will be a physical trainer, a trained certified in any gym of such caliber. There will be definitely physical therapists, certified trainers, but it may not have been executed properly. So it is an upcoming branch, not only for sports people, it is for everyone because lifestyle modification, so many lifestyle diseases are coming up. So it is a must. And I won't take long because it's going on and on. I will finish it. Once we were students, young students in the school, we had enough physical activity. We all did proper exercise and kept us fit. Now, if you look at the schools, what happens in 10th, 11th, and 12th? There will be a time allotted for all these exercises, activities, but what happens? It is for competition. It is for coaching for entrance classes. So from the school itself, the lifestyle activities is all completely gone. Then when it comes to college, again competition. And certain branches of science, if they enter, like IT sector, it's completely gone. So this sports medicine is an upcoming branch and it's a must. And I wish Balaji Medical College, I was talking to Dr. Johnson, they are planning to have post-graduation in sports medicine. And I wish and congratulate the Department of Sports Medicine, Sports Science for conducting this conference. I'm wishing and hoping that we will have post-graduation in sports medicine. Thank you.
I take immense pleasure in introducing our guest of honor, Chief Executive Officer of Kaivalya Dhamma Yoga Institute and Research Center, Lonavala, Maharashtra, Sree Subodh Tiwari. Born amidst the yogic atmosphere at Kaivalya Dhamma, Lonavala, he received spiritual initiation from Swami Digambarji. Sir graduated in law and also mastered in human resource management. He has dedicated his life to Kaivalya Dhamma Yoga Institute. He has coordinated the scheme of promotion of yoga in school by the Ministry of Human Resource Development and Department of Ayush. His goal is to qualitatively enhance the life of an individual through the practice of yoga and enhance the quality of environment through human efforts. With salutations, we are all ears to you, sir, for listening to your enlightening speech. Professor Dr. Subodh Tiwari, sir, are you online, sir, with us? So we come to the end of this inaugural session, and it's been a very glorious event today. We couldn't have asked for more. We've had the great persons in the field of sports medicine and yoga with us, felicitating and wishing us good luck for this first national conference. Thank you, everybody. Thank you, everybody, for your time, and thanks for being with us today and making this a cherishable moment. After this, we have our Professor Jaspal Singh Sandhu sir addressing the gathering. Yes, sir.
Thank you,
Jaspal Singh Sandhu, sir,
thank you, madam. I can hear you,
can,
madam.
please
Thank you
address
so
the
much.
gathering, sir. We're all ears to you.
Thank you, madam. Thank you so much. I was online at 9:30, but somehow that you know how technology works didn't work very well. I just got in. Thank you, Professor Murthy, for inviting me. Thank you, Dr. Krishnan, for being such a good host of sending me so many invites for this thing. I'll just talk how sports medicine had developed over the time in this country and in the world. I at present happen to be the Vice President of the Asian Federation of Sports Medicine and has been Secretary General of Asian Federation for a very long time. Before that, I was the President of Indian Association of Sports Medicine. How the thing started in sports medicine was that long time back, almost 95 years ago, a group of orthopedic surgeons got together and they thought that we should have a separate discipline in sports medicine, which is apart from the normal conventional orthopedics, because here you're primarily dealing with injuries which result from sports, and they're not as serious an injury as the kind of injuries we find in road accidents otherwise. So the first organization we came into existence was the International Federation of Sports Medicine, which is at present stationed in Europe, and it has a number of organizations which are the continental organizations which are being run as part of the FIMS. I happen to be the Vice President of Asian Federation of Sports Medicine. Then we have the African Union, we have the American, and we have the COPEMEDE. So all these organizations, they cover the whole of the world, and we get together. As far as the Asian Federation of Sports Medicine is concerned, it is at present stationed in Hong Kong, in the Chinese University of Hong Kong, but previously it was in my university for almost 10 long years. Asian Federation of Sports Medicine regularly conducts lectures and also gives traveling fellowships, but besides conducting annual conference in one of the Asian countries. India has hosted the 2012 conference in Amritsar, which was attended by almost 1,800 people and from almost about 70 odd countries, which includes 43 Asian countries, besides the guests we had for Europe and Asia and Africa and whatnot. This year, the conference was scheduled to be conducted in China, but unfortunately, because of Corona, we could not do it. Little bit about the Indian Association of Sports Medicine. It came to exist in 1974. It is not primarily an organization which is of the doctors. It is one of the organizations which takes in any kind of professionals which are very much concerned with the development of sports. Maybe they are nurses, maybe they are administrators, they are physical therapists, they are physical educationists, they are psychologists, they're dentists. Everybody is allowed to be part of the Association of Sports Medicine. The current president of the Association of Sports Medicine happens to be from your city, Chennai, and is Dr. Arumugam from Ramachandra Institute of Medical Sciences. So he's the outgoing president now. He will be followed by a president which will be from Jaipur, Dr. Vikram Sharma, and the president-elect for the one who's going to follow Vikram Sharma will be elected this year in one of the congresses. I happen to be the patron because I served this organization for the longest term of almost 6 to 8 years as the president. So they have been kind enough to put me as a patron. And so I continue with that on a supportive role, not that I am involved in the day-to-day administration. And the first department of sports medicine, without sports sciences to be exact, came up in National Institute of Sports in Patiala. And when I was there as part of a student of my diploma of sports medicine, I was an orthopedic surgeon already, but I used to play basketball. So ended up with lots of injuries, especially on the fingers and the knee. So I got interested in sports medicine and thought that I should go in for something which is different from conventional. And I ended up in Aegis Patiala doing my diploma in sports medicine. And at that time, there was the USSR and there was East Germany. So all our teachers used to be either from Cologne University or from the Russian Federation. And so they used to come and with the interpreters and teachers, and gradually, we have developed over time as an organization. What is the situation of sports medicine today is also of immense importance, because the government of India only about 4 or 5 years ago, where I happened to be at the time advising them in a big way, we decided that we should set up 6 departments of sports science in the country and 6 departments of sports medicine in the country. The 6 departments of sports sciences means primarily that they run courses which are in sports nutrition, in sports psychology, sports rehabilitation, in kinanthropometry, in biomechanics, and in sports biochemistry. All these, they become part of sports sciences. And we also have a department of sports medicine where they run the MD in sports medicine program. My university, Guru Nanak Dev University, was the first university in the country who started the Department of Sports Medicine in 1994, and it was started for one single room, and it became a gold standard subsequently. Phelps at the time, we used to accredit certain departments and rank them, and we were ranked at the top departments in the world at one time. And we still are ranked as one of the best ones which is available in the, and this has been replicated, this department is replicated in many countries abroad, where I have visited as either as examiner or as a consultant, where they replicated this. So now what the government of India has decided is that Ministry of Youth Affairs and Sports, which is probably a sponsor for this conference also, they have set up numerous sports science departments. Like in the central, we are the gold standard technically because we are the oldest, and we run the programs in the most. And I think everybody in the country knows that if you want to end up with sports science, go to GNDU. But that we are replicating the same for nutrition. We went to NIA in Hyderabad. So NIA in Hyderabad is running a program in sports nutrition. We went to University of Kolkata. We went to the Central University of Rajasthan. We went to Annamalai University and the LNIP Gwalior. So these were the ones which were considered for sports sciences. As far as sports medicine is concerned, the first MD in sports medicine was started again by Guru Nanak Dev University, but because I had to go as Secretary of the University Grants Commission in 2014, so after 3 batches which passed out, this MD sports medicine program in my department has since been kept in abeyance. So we don't run it anymore. And after coming back as Vice Chancellor, I do not have the faculty. And I am considered as the administrator, so I cannot run the MD sports medicine program. However, because we took the first lead in that, we also ensured that MD sports medicine should be run in other places in the country. And I must again, it's a matter of pride that York City, Chennai, and Sri Ramachandra was given the second MD sports medicine. Now they have 2 seats, if I'm not mistaken, sports medicine already. Ramachandra, Naru Mugam is the one who's running the show. Then the subsequently MD sports medicine was also given to Safdarjung Hospital and the Army Sports Institute in Pune. Now only recently Lucknow and this Rohtak Institute has also got the MD sports medicine. So this is the way the things are improving over the time, and this is the way sports medicine has come of age. What exactly is sports medicine? Because some of you people must be just still new, and you must be belonging to different disciplines and different fields which are not only medicine. So this is like an umbrella. It's not like a homogeneous single discipline. Sports medicine is not a single discipline, I must tell you. And it took me a very, very long time to explain it to a Medical Council of India that MD sports medicine is not a single homogeneous discipline. It has different branches. The most important obviously is exercise physiology. Then we have sports nutrition, we have sports psychology, we have training methods, we have sports biomechanics, we have sports dentistry, we have sports rehabilitation, we have sports biochemistry, and much more. Like, for example, in our university itself, we have a department of sports dentistry where we make mouth guards, custom-made mouth guards for contact sport. This is also part of sports medicine. So it's not a homogeneous organization. So it can include every discipline on earth, maybe to orthopedic surgeons, to physiologists, to rehabilitation people, to people from the Department of Psychology, then people from the Department of Dentistry, they nurses, physical therapists, they all get into sports medicine. That's the little bit about sports medicine, how it's grown and how it's happened with time. The second thing which is important in your theme of today's topic is yoga therapy, which again is very close to my heart, because Government of India had made a very important committee, very high-powered committee. It was headed by Mr. H. Nagendra, who is running the interdisciplinary center for yoga in Bangalore. As the chairperson, I happen to be the member coordinator of that, where we went on to decide what can we do to develop yoga in this country. This is our ancient science, which we are following much lesser than what the foreign countries are following. So we must maintain our heritage, make standardized protocols, start courses in yoga, and see to it that they are done, that they're given its due importance, what is to be given as far as yoga is concerned. So this committee went on to design various bachelor level programs, certificate level programs, and whatnot, and ultimately submitted the report to the government. And we are also at the time started the interdisciplinary center, which is the inter-university center of University Grants Commission in Bangalore, to develop yoga in a big way. Dr. Murthy, and I think Dr. Rao will be talking more about yoga, because I think I met him also. He must not be at the time when I was in Delhi, from the Central Council for Research in Yoga and Naturopathy. And also, it would be good if it would be possible for me to share the report of what our committee, high-powered committee, said to you, so that you people can also start yoga courses throughout in every university in the country. There is the only problem which we faced during this time of drafting this report was that yoga being ancient science, there's no standard text of yoga. There's no standard procedures to be followed. So then we had to consult n number of people throughout the country, because different kinds of yoga is practiced by different kind of people, so that some standard protocols are laid down for various kind of asanas which we do, and that's interesting part of it. So it went on for 2 years, this committee, and we ended up with this report. Dr. Krishnan, I am so thankful to you that your university in Tamil Nadu is I think the Central University also would be starting some kind of course in yoga, and if especially when this South India happens to be the hub of yoga development. And Dr. Murthy, thank you so much for inviting me. I'm so sorry, because I attended only this online system has become actually more of a nuisance than a help, because we end up with the conference or a meeting every half an hour. Everybody sends you a link and they want you to be online. So that's the way things have been quite difficult. So I already attended one of the meetings, and while I was waiting for you to let me in, now I got another one with the ministry in another 10-20 minutes. So for which I have to go to my committee room. So I apologize for being so short and so brief in this, but I think I've been able to give you a wide spectrum of how the sports medicine developed in this country, and what are the various institutes where education is done, where MD can be people can follow their MD, where people are going for sports sciences, and how yoga for University Center in Bangalore, you must always go and visit it, because they're doing humans research as far as the various aspects of yoga are concerned on the human body. Even to the extent that I was myself stunned to see the kind of neurocognitive studies done by people in Bangalore. Thank you so much, Dr. Murthy, for inviting me. I am so obliged. I beg leave now. I have to go for another meeting. I apologize for that. Thank you so much.
We have come to the end of the gathering. So I extend
my warm thanks to all the dignitaries who have joined us today. Thank you so much. In a short while, we'll break in for the scientific session. Thank you.